we are going to speak about the critical pulse of BLS, that is our basic life support. The major cause of death in this country is mostly cardiac arrest, and hence BLS, that is the basic life support, is a must for everyone. Each and everyone should know. If we can come across a person who is a victim, unresponsive and not breathing, in the mall, in the theater, in the marketplace, any crowded place, or even at home. There are 6 links that have been described in 2020 BLS guideline. The first link to the chain is early recognition of the cardiac arrest and activation of the emergency response system. Second link is quick chest compression within 10 seconds of recognition of cardiac arrest. The third is rapid defibrillation, because you have to stop the quivering action of the heart. The heart has to come to a still, and then only your CPR will act on the patient. So defibrillation will stop the quivering action of the heart, bring it to a standstill, and then the CPR will be effective to save the target organs, that is our brain, liver and kidney. And the fourth link is activated advanced life support component. The fifth link is the integrated post-cardiac arrest care, and the sixth link is the recovery. The 5 important steps. Scene safety. My scenes should be safe. As soon as I enter and see a victim, for example in a mall, the victim is just in front of me, has become unresponsive and not breathing. So first of all, I have to see that the patient is lying down on a firm and flat surface. For example, if the patient is in stretcher, we have to make the patient lie down on the firm flat surface on the floor. Then our CPR will be effective. Second point, tap the shoulder of the victim. Hello sir, can you listen to me? Can you listen to me? If the patient is not responsive, and quickly check for the breathing at the same time. See for visible chest rise. If there is no visible chest rise, that means the patient is not breathing. Or if the patient is having agonal breath, something like this is agonal breath, this is not a normal breathing. So we have to activate the emergency response system. We have to take the help of a bystander. Please help. Shout for help and get an activated emergency response system and ask for an AED, that is the automated external defibrillator. The pulse check is always to be into the adult victim, the carotid pulse. Where is the carotid pulse? It is in between the windpipe and a groove between the windpipe and the neck muscle. You place your 2 fingers and feel for the pulse for no more than 10 seconds. If you cannot appreciate a pulse, give the victim a benefit of doubt and start on with CPR. How to do the CPR? At the center of the chest, lower half of the sternum of the victim. If the victim is naturally putting on shirt or something, you have to bear open the chest or cut open the shirt, and then you have to start on with the CPR. Your heel should be placed, the left hand heel should be placed on the center of the chest on the lower half of the breastbone. The fingers, opposite hand fingers, should be interlaced. The elbow locked, the shoulder should be straight above the hand, and then count loud and give 30 compressions. 1, 2, 3, 4, 5, 6, 7, 20, 29, 30. After 30 compressions, 2 breaths. Look for visible chest rise also at the same time. 1 breath in 1 second. Close the nostril of the patient and then give head tilt and chin lift so that the airway is open. Alright, now I am giving a breath. First breath. 2 breaths. This is the ambo bag with the mask. First rescue will only do with the mouth-to-mouth breathing or with the pocket mask, the ventilation and the compression. Once the second rescuer comes, second rescuer whom you have asked for help, that person will come back with the ambo and the mask, and the AED. Bag mask is to be held by the second rescuer at the bedside, at the head end, with head tilt, chin lift, And this, as per HA, we call it as a EC clamp technique. We are holding the mask in the form of EC clamp technique. And then we'll give 2 breaths. 1, 2. And then again that person will wait for the ventilation, and another rescuer will be continuing with 30 compressions. And then 2 breaths. Remember, this bag mask ventilation is to be only done when there are 2 rescuers. Once the second rescuer comes, this bag mask ventilation will be applied. This is the automated external defibrillator. It has a green button and it has a red button. The red button is universal coloring of shock button, and this is the on and off button. As soon as we open the AED, we'll get 2 pads. We have to take out the sticker and we have to apply on the victim who is unresponsive and not breathing. This pad, as you can see in the drawing, pad has to be placed just below the right collarbone here. And this, as the drawing suggests, it has to be placed on the left side, diagonally opposite, just below the left armpit. Once the pads are placed here, then the AED will say analyzing rhythm. Next, the AED will say shockable rhythm. Once the AED says that it is a shockable rhythm, the person who is at the AED, the second rescuer, he will say, "I'm shocking the patient, stand clear please." He'll quickly see that his teammate is also not touching the patient to get a shock, and then he will press the button which is red color and deliver shock given. Then another important and crucial step where we tend to forget, once you have delivered the shock, you will never check the pulse. You will immediately come for CPR, or whoever is standing near the CPR, he will immediately start on with the CPR, and after 2 minutes, that is 5 cycles of compression and ventilation at the ratio of 30:2, 5 times, one has to check for the carotid pulse. So this has to continue till the ACLS team come over and take over, or the victim starts to move and is in the recovery position, and then the patient is to be shifted to the nearest center for further post-cardiac arrest recovery and care.